Hello, my name is Judith Poe. I'm a DMP student at Eastern Kentucky State University in organizational leadership, and my instructor is Dr. Jill Cornelison. The focus of this presentation is the vital healthcare information that needs to be communicated with each transition of patient care or handoff, and the application of leadership and change theories to address this healthcare issue in an organization. The Joint Commission defines transitions in care as the movement of patients between healthcare practitioners, settings, and home as their condition and care needs change. Approximately 70% of serious patient care errors occur during patient handoffs, according to a 2008 report by the Agency for Healthcare Research and Quality. The Joint Commission requires all healthcare organizations employ a standardized approach to handoff communication. There have been multiple articles and studies completed to evaluate the best way to address the communication gap that occurs when a patient moves throughout a healthcare organization. Wentworth and others in 2012 piloted an electronic SBAR tool in a progressive care unit, electrophysiology, and cardiac catheterization labs, which prior to the pilot, the staff spent a large amount of time searching through the EMR for the needed information. Abraham and others in 2014 did a comparison study of two handoff tools, SOAP, Subjective Objective Assessment and Plan, and a system-based handoff intervention tool, HANDIT. Paneska and others in 2009 wrote an article which discussed the Ticket to Ride, which was an initiative at the University of Pittsburgh's Presbyterian Hospital in response to events which had a high probability in resulting in adverse patient outcomes. I chose the transformational leadership and complexity adaptive systems theories to address this healthcare issue. Bass, in 1997, described the transformational leader as one who can move their followers beyond their beliefs and interests for the betterment of a group or organization. One of the first steps in addressing the standardization of communication during handoffs is motivating others to see how the change will improve a process for the greater whole. A change theory functions as a catalyst to encourage staff to group around a purpose or change. The staff then communicates information to others, which leads to adaptation of the proposed change. Renskow and Page in 2008 used the analogy of ping pong balls representing chaos and Velcro representing stability to describe how the complexity adaptive systems theory works in an organizational environment. Each ping pong ball represents a piece of knowledge, attitude, efficacy, or intention. As the balls bounce, there are pieces of Velcro representing potential motivational receptors to which they stick. New balls are added periodically with additional information or knowledge. The balls continue to bounce. Once enough balls stick to the Velcro, a tipping point or catalyst occurs, leading to adaptation of the proposed change. The planned change, which I applied the theories, is the creation of a standardized tool for handoff at all transitions of care. Complexity adaptive systems theory would be applied to move the staff to the age of chaos to promote the creativity needed to implement the needed change. A transformational leader would provide the staff the information and support they needed to rally around the goal of improved handoff communication. In summary, a transformational leader uses social skills to build relationships which promote trust and influence others to embrace change, which in turn supports the organization's mission and vision. Complex organizations exhibit chaos prior to adopting a change, which then brings stability to the environment. Leading change requires building relationships, whereas managing change is ensuring the change cycle is completed and sustained. The relationships a leader builds and fosters is the environment needed to plant the seeds of change. Thank you.